Good afternoon, everybody. Oh, I'm not sure if you can hear the messages that I'm hearing with people popping into the room. It's good to see so many of you here today. We're expecting Nadia actually along from Public Health, so you've got me and Amanda to fill just for a few minutes ahead of Nadia's arrival. So it's probably just worth mentioning today. Hi, Michelle. Sorry, my colleague Michelle Wykes is also here from Public Health, from the duty team. So once Nadia arrives, Michelle and I will do our level best to answer your questions for you this afternoon, and I'm sure there are quite a few. It's been a really busy week, but I'll take the opportunity, and Nadia's just arrived now. I will quickly take the opportunity just to say we're aware that there's been some in the national media today about the availability of testing around PCR testing and lateral flow testing, and it's probably just worth mentioning that what happens with PCR testing is, if there is an inundation of people all trying to book tests at the same time, the portal only enables people to book for the afternoon of the day you're on and the following morning. And as soon as those slots are all booked up, they will close the system, shut it down for a couple of hours, and then they reopen it when the next lot of slots come along. So that has happened this morning, obviously, because there's a sudden uptick in PCR testing. There was also a bit in the news yesterday about shortage of lateral flow tests. I don't think that's quite accurate, actually. I think what that is more about is, again, there was a sudden increase in demand from the general public for lateral flow testing kits, particularly because the 7-day testing has been mentioned and people have picked up on that. And what it actually was is the lateral flow testing kits were in a storage facility somewhere and not in the unit on the trading estate where they needed to be to get their name and address labels stuck on them. So that has now been rectified. So actually yesterday's little panic about availability of lateral flow testing kits should now be resolved, and similarly that the PCR testing system, it's just busy, it's the same thing, just hang on and try again half a day later when there should be more slots available. So sorry for taking up your time, Nadia. I just thought it was useful to cover that.
Lovely. No, thank you. Are you okay, colleagues, early years colleagues? I'll just do a little bit of a spiel of where we're up to and talk about the changes. Is that okay? Yeah.
That's fine, but somebody says they can't hear.
Can't hear? Oh, can you hear me? I can see that everybody's got, there's some people that seem to have their microphones.
Yeah, Studley looks as if they're away. I don't know. I don't know what's going on there.
It's funny because people look like, not only are they muted, but there's a sort of little camera and...
Yeah, a little symbol, isn't there? It might be worth leaving and rejoining, see if that works.
It's saying that Studley Sneakers is offline.
Left. Don't worry.
Can everybody else hear? Can everybody else hear, just to check?
I can hear you, Nadia.
You can. Oh, Marianne. Emma, yes. Castle Nursery, yes. Right. Brilliant.
Yes.
Brilliant. Okay. Wonderful. Okay, that's great. That's great. Well, it's good to be here, and I know things are changing really, really quickly. And so just give you a quick update. I'm just going to show you where we are with rates at the moment. So let me show you this chart. So unfortunately, you can see, if I just scroll down, we've got the rates in Coventry and Warwickshire are going up, and they're going up quite sharply. So you can see Stratford district at the top with the highest rates, then Rugby, and then we've got, I think it's North Warwickshire, then Warwick district, and then the Neaton and Bedworth. But actually the trend is all upwards, and actually when you look at Coventry, which is the blue line at the bottom, they've been going down very, very nicely. They've just had a very, very sharp uptick. We absolutely believe that this relates to the new Omicron virus. So you'll have heard that we think that the number of cases is doubling every 2 days, potentially closer to 2 days and 3 days now. and they think by tomorrow-ish, so middle of the month, there may be a 50-50 split between cases that are Omicron cases and Delta cases, and by the end of the month it's likely to be entirely Omicron cases. The initial guidance around Omicron was different to previous guidance. They were asking close contacts to self-isolate. However, as of today, there are new rules around self-isolation. So I was going to go through those with you and then talk about a few other things that are really important for Omicron. So the first thing is that the guidance now is this bit is actually not different to the previous guidance. So anybody who is unvaccinated or partially vaccinated, so they haven't had 2 doses of the vaccine, and they're adults, and they're a close contact of a COVID case, they must still isolate for 10 clear days after the last contact they had with the case. That's clear, that's still the same. The thing that has changed is for vaccinated, fully vaccinated adults, so adults that have had 2 doses who are close contacts of COVID cases, they are now being asked to do daily LFT tests for 7 days, after that last contact. So that's the national guidance for adults who are fully vaccinated. Our local additional recommendation or advice, I should say, is that we also, because the lateral flows are great at what they do and they do pick up some cases, we're still advising PCR tests as well for those vaccinated adults. So they can do their daily lateral flows, but to take a PCR as well, because they are more sensitive and you may well pick up more positives in a time where actually we've got this new virus circulating and it's circulating very widely. So that's for fully vaccinated adult contacts. And then for children under 5, the national guidance says they do not require a PCR test or LFT testing unless they're a household contact of a positive case. However, as you know, our local guidance is that if it's acceptable to parents, then we recommend a PCR test for close contacts and also for regular LFT testing if it's acceptable to parents. So that is over and above the national guidance. We can't refuse a child to come back into a setting if they haven't had a PCR test or an LFT test, but we can refuse them if they have any of the COVID symptoms, as you know. So I think the key thing to say is that all of the changes I've just talked about are for close contacts, not for cases. For cases, everything remains the same. If you have any of the COVID symptoms, no matter how mild, then you should isolate and book a PCR test, and that stays exactly the same. Also, if you've got COVID cases in your setting, we would ask you to be vigilant for some of the other sort of softer symptoms as well, which we know people get: sore throat. Well, I don't know whether they're soft symptoms really, they're just probably less common symptoms: sore throat, headache, fatigue, muscle ache. So be mindful of those as well if you have COVID circulating in your setting. So I hope that's clear. I don't know whether there might be some questions on that, and we will write out to you with that. So the national guidance is this is just for close contacts now. If you're a close contact that is not fully vaccinated and you're an adult, then you must isolate for 10 days. If you're fully vaccinated and you're a close contact and you're an adult, then you need daily LFTs for 7 days after the last contact with the case. And we are recommending on top of that a PCR test as well. And then for children, according to national guidance, if they're under 5, they don't need to isolate or have a test. However, we recommend, as before, PCR testing and LFT testing if acceptable to parents. So that's that. But anybody with symptoms must isolate and book a test. So I hope that make some sense, or we'll try and get that out in writing to you as well, because I know it's very contentious and really difficult. Right, there's a few questions, and then I'll talk about some of the wider things as well very quickly. So, staff member who received her vaccination in Hong Kong was previously unrecognised in the UK. She still had to isolate if she was a close contact. Yes, unfortunately, she will need to still isolate as a close contact, because I'm not sure that our system has been able to recognise that, unless they come through to us in DPH admin and we can see if the vaccines that they've had are MHRA approved, in which case we could make a special case for her, which I know a couple of people have done that, but obviously we can't do that for everybody that's been vaccinated abroad. But if there's a particular member of staff that you're concerned about, ping it through to us if they've got evidence, because if we can check, we can probably if you're in that situation, we can probably help, if that makes sense. I'm sorry, I can't hear anything. Sorry, Studley Sneakers. Not sure what to suggest. Oh, they're waiting in the lobby. Here we are. Hopefully they can hear us now. Are we able to ask for evidence if a parent takes their child for a PCR test? So no, I mean, you can ask parents to let you know if they have done a test and what the result is, but asking for evidence, I think, is tricky. But I think if you're really concerned that somebody is, potentially symptomatic or unwell and coming back into your setting, then, you should have that conversation with them. I think asking for evidence is, usually not required. But, I know a lot of settings will ask parents to tell them, what the results are of the tests. But I think asking for evidence, we know some schools do ask for evidence, but I think in the national guidance it does say it's going too far. But you can ask them to let you know, there's no harm in that. And if they don't, it's just that what you do next is the critical thing, isn't it? Because it is difficult to force. We can't force them to show evidence, if that makes sense. Will she be able to get a booster here? Yes, definitely. We had some cases like that. A vaccination site in Coventry on Sunday. We had somebody who's, we had actually quite a lot of people who had their first and second jabs abroad. They just need a bit of time to work out things and to make sure it's all logged on the system. But she should be able to. I would advise actually looking at the drop-in vaccination sites, because drop-in is probably easier than trying to go through the online system, because they might get a bit, they might find some barriers there in the online system. But I think if she's able to go to a drop-in, there's look at the drop-in clinic's website it's on the bottom of all their email signatures. I know it's come out to you a few times, but we'll talk about that. Jane's just putting something about Studley. Oh yes, we're recording it. Okay, if the child's unwell, they shouldn't be in the setting. Yeah, absolutely. Yes, absolutely. Yeah, that's right. Because because usually if you're wanting to ask for evidence of something, it's because you're concerned about something that the parent is telling you. So I mean, if you've got difficult situations like that, you can come through to us, and we've advised on those sorts of situations before. Yeah, but if you're concerned the child is unwell, we've had a number of those where the parents don't want to test, but the child's unwell and the setting doesn't want to accept them, and you're very within your right to do that if they're not well. Yeah. I hope that helps a little bit. But just in terms of other things to think about, because this Omicron variant, we know it's going to spread very quickly. I'll answer that question, Mary, in a second. So as I said, I think by the end of this month, probably all our cases will be Omicron cases. We think it's going to completely get rid of Delta. Because it's spreading so rapidly, it'll be Omicron. You won't be advised now. We were trying to follow up single cases, but there's so many of them now that we wouldn't be able to follow up each single case now. So we're almost moving to looking at Omicron like business as usual. But what you do need to think about for your settings, because it's going to spread even more easily, unfortunately, than Delta, it's thinking through how can we reinforce everything that we've already got in place in terms of our risk assessments. So how can we make sure that we really are ventilating our ventilating our settings well? How can we make sure that we're keeping up with that regular cleaning? I think, you know, your staff are a really precious resource. Make sure they get boosted. Really, really important. They need 3 doses, not 2 doses, because the Omicron variant will not, well, the vaccines, the 2 doses of the vaccine are not as effective against the Omicron variant as 3 doses seem to be. We need everybody to get boosted. That's really, really important. What else was I going to say? Think about your staff. Think about, you know, break times. Do they mix in those staff rooms? Do they cross cover? How can you actually try and minimise some of that? I mean, I'm talking about, you know, put us thinking about this phase as we go into this upswing into Omicron, not forever, but I think we need to re-look at all of those measures, and really being clear with staff that, you know, they shouldn't be mixing with each other in the workplaces. If you can try and minimise that moving across bubbles or rooms, then that's great. Have you got just 1 or 2 members of staff that greet all the children as they come in? If so, maybe think about doing things differently, so you've got the staff in that room who greet the children as they come in, because what would happen, you know, if you had that one member of staff becomes positive, then, you know, you've generated a lot of close contacts then and potential for spread. What else? Thinking about, you know, cleaning of toys and things between sessions, that sort of thing, also really important. Or quarantining your toys for 72 hours and then bringing them back. All of those things are really, really important. But I can't stress enough how vaccination is so important for staff. So that is really important as well. Right, so let's have a look. There's a few other questions. So I've answered the one, you won't be advised now if positive. By the end of the month, pretty much everyone will be Omicron, so that you can assume they will. What's advised with vaccinated pregnant staff? Should we be more cautious with the new variant at the setting? I think so. I think this comes down because I think every pregnant member of staff does have to have an individual risk assessment, don't they? And, you know, obviously we'd like them to have had both of their jabs, and if they're eligible, they will be eligible now in the age cohorts, won't they, to have their boosters as well. So really promoting that booster, thinking about how you can mitigate that risk if they are in the setting. And if you're not able to mitigate that risk, then I think it's thinking through what are the other options for that member of staff where they don't have to be in such close contact with others. I'm probably getting myself into hot water there, and early years colleagues may want to come in on that one because it's a really difficult one, but it is all about that risk assessment, I think.
No, I agree with you, Nadia, and that's what the health and safety advice is as well. There is guidance out there for employees who are pregnant, and also for employers and pregnant employees, so it's important that you have a look at that as well. But certainly the risk assessment is key, and you know, you may, as Nadia says, need to put people onto different duties.
Yeah, absolutely. Are the rules different with Omicron? So no, so there's been a change now. It was different, but now they're treating all cases the same. So any case of COVID has to isolate, that's true, but close contacts now, the main advice for close contacts is if you're not fully vaccinated, you're isolating, essentially, and you can test as well, and probably should test, because obviously if you're positive, it's a good thing to pick you up, to pick up that you're positive early in your isolation period, because then you can, you know, make sure that your family do the right thing, etc. as well. So you isolate if you're not fully vaccinated. If you're an adult and you're fully vaccinated, as I said, it's 7 days of LFTs after the last contact with the case, and on top of that, we do advise a PCR as well. For under 5s, nationally, they say you don't need to isolate and you don't need to test, but we advise that it can be really helpful to test, and to advise PCR testing and LFT testing. Again, that's up to parents too. So that's now for all cases. So there's no difference. You know, it doesn't matter if it's Omicron or Delta. Those are the rules. Yeah. Oh, Becky, you got it. Brilliant. That's good. Jelly beans after a positive test. You can't have boosters for 28 days if you're an adult. That's true. Yeah, as we won't know if the positive was Omicron or not. Will it affect their need to isolate until they can get a booster? As we won't know. No, it shouldn't be. No, it's 28 days. Yeah. Are you meaning has that 28 days changed because of Omicron? No, I don't believe that's the case. No. For 12 to 15-year-olds, just so you know, if you're a healthy 12 to 15-year-old, they're saying wait 12 weeks after COVID, after you've had COVID to have your vaccination. But actually, children aged 12 to 15 who are in risk groups, it's still 28 days. So if that makes sense.
Yeah.
Yeah.
I think they're asking whether that person needs to isolate until they can get their booster. So because they can't have the booster for 28 days, so they need to continue isolating.
No. So with Omicron, you isolate for 10 days if you're an Omicron case, and that's it. Yeah. Does that make sense? Yeah.
Yeah. So I think what you're saying is they can't get the booster, but they don't need to continue isolating until they can get it.
Yes. Yeah, that's right. That's
a complicated one.
Yeah. So if I've got Omicron today and I do my 10 days isolation, today would be day 0, and then I do my 10 days isolation and I come out on day 11, I can't have my next vaccination until 28 days after day 0, which is today. But I don't need to isolate after day 11, if that makes sense. So yeah. I still have a Stephen Bridge refusing to get vaccinated. Yeah, it's a shame that causing big issues as she works between 2 sites. I'm not quite sure what to suggest, because I know that people have different reasons for not wanting to get vaccinated. I'm not sure if they've shared any of those with you. I think it's important that staff are aware that we don't know enough about Omicron at the moment. We know it spreads rapidly. We don't know enough about the severity. You'll have seen yesterday we've had our first death, haven't we? It may be that it causes less severe illness, but even with that, if it spreads really, really rapidly, even if only a small proportion of people get severe illness, that will still be a lot of people. And so I think it's really important that they know that actually the risks are more heightened now than they were sort of before the end of November, when we didn't have Omicron in the country. So I think it's important that they understand those risks. And yeah, I don't know what else to suggest other than, if there are particular concerns about the vaccine that you think we could help bust some myths with, we'd be happy to. Thanks, Jessica, for posting the advice for pregnant women, and Amanda's posted something from ACAS as well, which is helpful. Thank you. How long after a child is tested positive can you PCR again? Oh no. Okay, so I was hoping you weren't going to ask me that. So this is a bit contentious at the moment. At the moment, it still sort of says that you don't need to test again and for 90 days after you have for 90 days after you've tested positive for COVID. You don't need to test again unless you've got symptoms again or you're doing a travel test. However, this may change, and because we know that if you've had the Delta virus, you may have little protection against Omicron. You might have some, but you may have little protection. I think it makes sense. Certainly if you've got symptoms, you must test again. If you're doing a travel test, you must test. But if you're asked as a close contact to test, I would test. Because if you've had close contact with somebody with Omicron, you don't know that even because you've been positive in the last 90 days. So because they're certainly saying for close contacts with this daily LFT testing, they've not mentioned that if you've tested positive in the last 90 days that you don't test. So in fact, I think they said on the briefing yesterday that you should. So what I'm saying at the moment is that we would say anybody with symptoms should have a PCR test, and if you're close contacts, I would, in this kind of uncertain time, do that. But I am trying to clarify that point with UKHSA colleagues. So for now, I would just say test, but I will clarify that point, which I'm trying to do. Yeah. Okay. And then, do we know if many people are catching COVID? Do we know if many people are catching COVID more than once? Yeah, so they are thinking with this Omicron that yes, there is a higher what they call reinfection rate. So if you've had Delta, you may well go on to get Omicron. Prior to that, with the others, Alpha and Delta, and even the very original COVID, if you remember that, going back in time at the beginning of 2020. I think there's a very small proportion of people were getting reinfected, but they think there is a higher rate of reinfection now with Omicron. So I think that's where there's that concern around if you've just had COVID, you know, sort of prior to the end of November, when we probably were seeing Omicron start to circulate in the UK. If you've had COVID previously, you know, you can get it again, I think, but the evidence is still emerging on that one. Yeah. Is that okay? Is that okay? Yeah, brilliant. So I don't know if there are any more questions. Happy to take them, but we'll try and get the wording out around the close contacts. But the key is really reinforcing all of your measures, getting people boosted. I sound like Boris now, don't I? But it's really important. It's so important.
Your hair's not messy enough, Nadia.
Oh, is it not? Do you know, I'll tell you a little. No, I can't. No, I was going to tell you an anecdote, but it was inappropriate. But you know, I definitely, you know, it's just so important we get all our adults boosted. You know, wear your face coverings when you're circulating. That's in the early years guidance. That's really important. And also, you know, obviously in all of the settings where it is now mandatory, you must obviously wear a face covering as well. Keep up with all of those measures, but we'll try and clarify the close contacts so that you've got it in writing as well, what you're supposed to do with them. Hopefully that helps. Yeah.
Thanks, Nadia. That's been really useful.
No worries. Lovely.
Okay. If we don't have any more questions for Nadia, I'll say thank you once again to all of you for your help and support.